In this evening's health report, Shamela Pullen looks at gallbladder disease.
The gallbladder is a small pear-shaped organ located under the liver. Its main function is to store and release bile, a digestive fluid produced by the liver that helps break down fats. If bile cannot flow properly into the small intestine, it may build up in the bloodstream.
While the gallbladder does not make anything of its own, well, just mucus, it's really important because it helps the liver to be more efficient. The liver continuously secretes substances which help to break down the food, and when we're not eating, the gallbladder's role is primarily to concentrate those secretions and release them when we eat. Now, when the gallbladder starts to become diseased, then we can have problems. One of the most common things which can happen to the gallbladder is the development of stones within the gallbladder.
Gallbladder disease often causes pain and discomfort. Common types of gallbladder disease include gallstones and cholecystitis.
Patients with acute cholecystitis usually have a history of discomfort or pain either in the right side or in the center of the abdomen, usually after a meal, anywhere from half an hour after a meal to up to 2 hours or so after a meal. Patients who have gallstones tend to get this discomfort, and it's in the center of the abdomen or on the right side, sometimes radiating to the back. This may be accompanied by nausea or vomiting.
In several cases, it may lead to infection, liver damage, or other complications. Certain medical conditions and lifestyle factors can increase a person's risk of developing gallbladder disease. These include a high cholesterol diet, obesity, diabetes, sickle cell disease, and Crohn's disease.
Better, and it prompts the patient to go to see the doctor. Diagnosis of acute cholecystitis is usually done by history and examination, and additionally with the help of an ultrasound, which can show the thickening of the gallbladder and the distension. The only effective treatment for acute cholecystitis is removal of the gallbladder and operation that we call a cholecystectomy, and this is currently done laparoscopically using a few small incisions, and that is the current standard of care for gallstone disease.
With our health report, I'm Shamela Pullen, wishing you good health.